for M is able to cause a quick response, calcium response, and we put it after CPA, this response was depressed, indicating that endoplasmic reticulum is the possible target. And when we use it combined with nigericin, we saw that for M, it still has the response, but when we put it before nigericin, we saw that the response of nigericin is faster. So for M, maybe it's acting other calcium pools and maybe it's causing the acidification of cytoplasm. Additionally, we saw that for M has the low toxicity, and this calcium response is specific for Plasmodium parasites. Once we tested against murine hepatocytes and we didn't see any response. These results putting for M as good scaffold for further studies in the malaria drug development. Thank you.
Okay, great job. Under time. How about that? And sorry, I pressed record, everyone, and I didn't quite get the beginning of your talk, so apologies. Totally forgot to do that. All right, so next on our list will be Asta Varshne. Take it away.
Hello. Hi, good morning, everyone. I'm Asta Varshne, working under the supervision of Dr. Satish Mishra at CSI CDRI in Lucknow, India. So I'm going to present my work, which is entitled Plasmodium PV anchor 030450 is critical for transmission of parasite in mosquito. Here, this gene is Plasmodium specific and highly conserved as well as with unknown function. So I gave it here name as UNK. We selected this gene. This gene was reported to be highly upregulated during the sporozoid stage. So many US genes are previously reported to be implicated in mosquito as well as in liver stage development. To understand or for the localization, basically to confirm its role during the transcriptome data at analysis at basically to analyze its transcriptome data at protein label, we have tagged this gene with 3X HAM cherry and found and demonstrated its expression during all the stages of the plasmodium and found that it's highly expressed in schizoid stage, gametocyte stage, eukaryotic stage, as well as in other as well as in liver stage development. Next we attempt to co-localize it with different markers like apicoplast marker, ACP, mitochondrial marker, as well as with the HSP70, which is cytosolic marker, and found that this gene is highly expressed and localized in cytosol. Now, next we have attempt to generate its knockout to understand its role in the plasmodium life cycle. So the gene expressed, basically, we have generated a knockout by double crossover homologous recombination method, and the confirmation was done by GFP expression as well as with the PCR genotyping integration checkup. Now, this gene is when we did the blood growth propagation, we have checked the blood growth stage propagation. By disturbing this gene, we did not find any effect during the blood stage propagation in asexual stages. But when we have transmitted it to that of the mosquito stages, we find that the reduction, there is highly reducing the number of oocysts, and which lead to impairment in further stages such as salivary gland sporozoid. So to understand the defect of this gene, we systematically analyzes the gametocyte count and found that the gametocyte number is significantly reduced as compared to the wild type. So next, we concluded that the low number of gametocyte will lead to a lower number in other further stages such as eukaryotic stage, oocyst stage, midgut sporozoid stage, salivary gland sporozoid as well. So all these stages are low as compared. So the reduction in the number of gametocytes will lead to a reduction in every other stages. So we are next in future we are planning to generate its conditional knockout for further to study its role in beyond mosquito stages, as well as we are doing RNA-seq analysis from gametocyte stage to understand its transcriptome. Thank you.
Great, thank you, Ashta. Okay, so next up, we have Fred Owino. And let me get to your slide. Oops. Ah. Oh, sorry, having some technical. There we go.
Oh, hello everyone. It's evening here. My name is Fred Owino. I'm in Nairobi, Kenya. This work I want to present is part of my master's project. This work is based in Nairobi at Kavi Institute of Clinical Research. And what I'm going to present today is just part of the work that's incomplete, and the data that's here is just preliminary data. Now, going to this work, we all know malaria is a big threat to the tropical regions in the world. And this is has more effect, especially in sub-Saharan region. Now, we have a lot of malaria infection that occurs especially in regions like Kenya, where I'm from. And we notice that during malaria infection, especially to pregnant women, the parasite tends to sequester inside the placenta, causing placental malaria. Now, during infection, one of the largest immune cells in the placenta is macrophages. Macrophages tend to sustain pregnancy, and therefore, when there is a change in the placenta, that is when there is infection, then they recruit other cells that causes pro-inflammatory effects. These effects increases of the chances of poor pregnancy for mothers that have malaria. So for this study, we are looking at macrophage responses, how they polarize in case of changes in the microenvironment within the placenta, and how the effects can affect the outcome of the pregnancy. So to do this, we look at a number of factors, and one of them is change in the macrophage phenotypes, that is the different subtypes of macrophages. And also we look at the transcription factors that lead to manifestation of these proteins. And also we look at the localization of the parasite as well as the markers in infected placenta. So for this particular one, I want to just show you the two assays. That is flow cytometry, where we look at the different markers of different macrophage phenotypes. And also looking at different genes that are expressed when there is infection. Like I've mentioned, when there is a change in the microenvironment, that's a change in the placental environment due to infection with Plasmodium falciparum, for example, then macrophages are the second largest immune cells, recruit other cells to come to fight the disease. And in doing so, this results into pro-inflammatory effects that can end up causing the deleterious effects to the mother and also the fetus. So for the markers, we look at the effects or the expressed phenotypes. And for the transcription factors, we look at the genes, how these genes are expressed. And so far, what we've observed is that there is increased expression of M2 subtype of phenotypes. And M2 subtypes are also called alternative macrophages. And these are macrophages that are called anti-inflammatory. Pardon?
You have 15 seconds to wrap up. Sorry.
All right. So so far, what we've discovered is there's not much change in these different phenotypes for the two different subtypes of macrophages. But like I said, this is just preliminary data, and we're yet to see more as we continue to do this work. And we hope that what we get will be able to help in coming up with a therapy that's able to resolve this kind of issue. Thank you.
Okay, great. Thank you so much. Next up is Marco Pinto. I'm glad you could make it. I know you're having some trouble getting on. So let me get to your slide. There you go.
Okay, can you hear me? Hi?
Oh,
Can
great.
you hear me? Can
Yes.
you hear me?
Yes, we can.
Yes? Well, first I would like to thank the organizing committee for inviting me. I bring you a work that summarizes the important role developed by the basic sciences and its application in medicine. I outline the role of the laboratory in the diagnosis of malaria in non-endemic countries such as Portugal. Malaria is a medical emergency, and the most important agents in human are Plasmodium falciparum, malaria, vivax, ovale, and knowlesi. Plasmodium falciparum may lead to severe malaria. In non-immune individuals, the Plasmodium falciparum infection, the median pre-patent period is between 5 and 10 days, and the median incubation period is between 6 and 40 days. Plasmodium vivax and Plasmodium ovale may relapse months to years after exposure due to the presence of hypnozoids in the liver. The precise and timely diagnosis of malaria plays a capital role in the timely treatment and overcoming of the risk of fatal outcomes. Analytically, the thrombocytopenia is the most common finding, followed by hyperbilirubinemia, anemia, and elevated hepatic aminotransferase. Leukocytes counts are usually normal or low, but an increase in band forms can be noticed in many cases. Erythrocyte sedimentation rate, C-reactive protein, and procalcitonin are also elevated. The laboratory gold standard methods for diagnosis and parasitemia, determination of malaria are thick and thin peripheral blood smears. In the clinical suspicion, if the clinical suspicion is substantial and the parasite is indetectable in the first blood smear, it must be repeated every 12 to 24 hours for a total of 3 sets. If all the 3 are negative, the diagnosis may be ruled out. Other malaria diagnostic tests are available, as rapid diagnostic tests and indirect fluorescent antibody tests. But due to limitations related with these tests, the gold standard still being the peripheral blood film. Present in my case report, a 2-year-old girl with Down syndrome and acute myeloid leukemia came to the hospital with fever. She had traveled to Angola. Analytical, she presented anemia, leukopenia, thrombocytopenia, and elevated hepatic aminotransferase, bilirubin, lactate dehydrogenase, and procalcitonin. Due to thrombocytopenia, a peripheral blood film was made, revealing the presence of Plasmodium falciparum trophozoites. With the parasitemia of 33%, with 15% of the parasitemia or parasited erythrocytes with multiparasitism 2 to 5 trophozoites, some showing acoliforms, merozoites outside erythrocytes, and plasmacytoid lymphocytes. The patient was treated with quinine sulfate and doxycycline for 7 days. My take-home message are: always consider malaria in febrile patients coming from endemic countries. The laboratory gold standard methods for diagnosis of parasitemia determination are thick and thin peripheral blood smear. If clinical suspicion is substantial and the parasite is undetectable in blood smear, it must be repeated every 12 to 24 hours for a total of 3 sets. Thank you for your attention.
Thank you. Okay, so next up, we will have Peter Okutu speak.
Oh, sorry. Yeah. I'm Peter Okutu. I'm presenting on the differential pattern of IgG subclass response and its ability to Plasmodium malaria reticulocyte binding protein 1A. Now, malaria is a devastating health complication. However, efforts to design vaccines against malaria has all been geared just towards Plasmodium falciparum and Plasmodium vivax. And this situation, when it's continuous, is going to lead to the situation where there will be a stamina in the global malaria eradication efforts. So my lab have been researching on Plasmodium malariae, and we've been trying to see if we can be able to get a possible vaccine candidate out of it. So to do this, we screen a lot of proteins from the erythrocyte binding protein of Plasmodium malariae, and we found the Plasmodium malariae erythrocyte binding protein 1A as a very possible one. And the reason we say it's possible because it's in the same class of proteins with RH5, which is one of the promising vaccine candidates in Plasmodium falciparum currently. And also the tertiary structure of our protein is also similar to RH5. Therefore, we believe that our protein is a very good candidate to look out for in designing a vaccine against Plasmodium malariae. To do this, we extracted our gene sequence from PlasmoDB. We predicted a domain. It was a big size, so we had to fragment it into portions. We expressed it in an E. coli cell, and we purified. From our results, as I have on my SDS page here, we have, after purification, we have our bands, and we have a very clean band. However, when we did a Western blot to confirm, we saw a little band beneath our main band, which shows that our protein was existing as a homodimer. However, because it's the same protein, it still gives us the option to go ahead. So we ran an ELISA to see if our protein, our antigen can be able to elicit immune response. And that's what can give us the belief that it can really be possible as a vaccine candidate. So we ran our ELISA, and from the ELISA, we took serum from blood, serum from people living in malaria and endemic areas, regions in Ghana. And from our results, we can see that IgG1 and IgG3 are the most prevalent across all the regions of samples that we took. Therefore, we believe that IgG1 and IgG3 are very promising, and any vaccine that is targeting Plasmodium malariae should be able to elicit IgG1, IgG3 as part of its anti-immune responses. Also, we believe that this knowledge can help in making a well-informed decision in vaccine production. Now, there are a couple of works we are still doing, because this is just a smaller picture of a bigger work we are doing. I'm trying to increase my screen. Yeah, so next we will be looking at checking out for the erythrocyte. We do an erythrocyte binding assay to see the regions of the erythrocyte that the binding occurs. And we'll also be looking at the biophysical and structural characterization of our protein. Thank you.
Thank you, Peter. Okay, next up we have, oh, and can you mute? Oh, maybe someone else, sorry. Next up we have Raksha Devi.
Hello, good morning, everyone. My name is Raksha, and I'm working as a research scholar under the supervision of Dr. Satish Mishra at CSIR CDRI. Today, I'm going to talk about the Plasmodium malonyl coenzyme A acyl carrier protein transacylase that is critical for the liver stage development and initiation of the blood stage infection. As we know that apicoplast is an important organelle that is present in the malaria parasite, but they are not, they are absent in the mammalian host. So they are a range of the metabolic pathways that are present in this, that occur in this apicoplast organelle. And they are different from that of the mammalian host, so can be targeted as an anti-malarial drug target. The type 2 fatty acid synthase pathway is one of these pathways, which is essential for the parasite's development. So here we are targeting an important enzyme of this pathway, which is MCAT, which stands for the malonyl coenzyme A acyl carrier protein transacylase. This particular enzyme is responsible for catalyzing the reaction where the malonyl ACP is produced from malonyl coenzyme A and ACP. So here, in order to know the role of this gene throughout the parasite's life cycle, we first generated the knockout of this parasite by using the conventional approach. And after generating the knockout, we found that this knockout parasite shows normal growth in the development throughout the mosquito stages, which we can see from the figures. Then, in order to know the infectivity of these knockout sporozoites, we performed an in vivo experiment where we checked the prepatent period of these knockout parasites. So the result shows that this knockout parasite, it shows the delayed prepatency period in comparison to the wild type parasites. This could be possibly either due to the reduced infectivity of these sporozoids, knockout sporozoids, or due to the sporozoids that failed to develop into the mature merozoites. In order to further investigate this result, we performed an in vitro experiment where the knockout as well as the wild type sporozoites, they were allowed to invade the hepatocyte cells, and these cultures were harvested at 42 and 65 hours post-infection. The cultures were then stained with anti-US4 antibody. The result shows that the knockout parasite, it shows normal growth in the development up to the 42 hours post-infection, but at the 65 hours post-infection, the parasite shows the reduced nuclear division in comparison to the wild type parasite. The culture were then also stained with anti-MSP1 antibody, which shows these knockout parasites, they fail to develop into the mature merozoites. So these results conclude that this particular enzyme, it is responsible for the development of the parasite at the late liver stage development, and in the transition of, and plays an important role in the transition of the parasite from the liver to the blood stage. So further we will further we will perform further we will check the method at the mode of the attenuation that is being used by this particular enzyme for this mode of the attenuation of this knockout parasite, and combining this particular enzyme with another gene in order to generate a gap vaccine. Thank you.
Thank you. Okay, now we are on to our last speaker, Shanda Aja.
Hi, I'm Shanda Aja from University of Ghana, and my talk is on measuring antibody responses to crude malaria antigens in children with different hemoglobin genotypes. So in malaria endemic areas, hemoglobinopathies have been found to confer protection against malaria. And these hemoglobinopathies are a result of mutations in the gene that produces hemoglobin. They include hemoglobin S and hemoglobin C. So we sought to find out if there is a correlation between the protection conferred by the hemoglobinopathies and the level of antibody production. So we aim to measure antibody responses to crude malaria parasites antigens in children with the genotypes AA, AS, ST, and AC. So we did this by culturing the Plasmodium falciparum parasites, and we used the schizons to prepare crude parasite extracts for ELISA. And from our results, we observed that the children with the genotype AA produce the highest mean antibody responses, followed by the AC, the AS, and then the SC. The results were statistically insignificant, but then we attributed the low mean antibody responses seen in the hemoglobinopathies to be due to the fact that in the hemoglobin S, the sickle shape makes the RBC environment very hostile. So it prevents the invasion and the normal growth of the parasite in the hemoglobin S RBCs. And hi, can you hear me? Hello?
So what's wrong?
Sorry, I received a message from someone, so I thought you couldn't hear me. So let me continue. So for the hemoglobin C or the AC genotype, their RBCs have the ability to crystallize, thereby making the cells rigid, so that the RBCs become unfavorable for the parasites to invade and grow as well. So we attributed the very low mean antibody response seen in the SC group to be due to the combined effects of having one S and one C allele. And the high antibody responses we found in the AA could be due to the fact that the mechanisms seen in the hemoglobinopathies are not observed in the AA genotype. We also found the effects of age on antibody responses, and we found an age-dependent increasing trend where the older children produce higher mean antibody responses than the younger children. And this was also found to be true when we assess the effects of age on antibody responses in the genotypes AS and AC. And we attributed this to the fact that in endemic areas, there is a development of acquired immunity because of frequent exposure to the malaria parasites. Thank you for listening.
Okay, thank you, Shonda. So we have about 4 minutes left. If anyone wants to ask any questions. This could be for any talk. So. Okay, there aren't any questions. Does anyone have anything to add or any comments on anyone's presentation? Okay, in that case, we can conclude. Thank you everyone for your talks. And just a reminder that you'll have to use the webinar link to begin listening again to the talks that are coming up in the afternoon after we eat lunch and maybe you guys eat dinner or whatever. But yeah, thank you guys so much and good luck on all of your research.
Thank you, Margot. Thank you, everyone.
Thank you.